This condition that I am discussing is basal cell carcinoma. Might also seen this listed as BCC. Its clinical importance of older adults, it's because it's the most common skin cancer in this population. And this is because as patients age, their cumulative exposure to the sun, their decreased immune surveillance, and thinning of the skin increases the risk of developing these malignancies like BCC. BCC early recognition is critical because BCC rarely metastasizes. Delayed diagnosis, though, can lead to significant local tissue damage, and that would be really prominently found in the face. So, again, just because it doesn't really metastasize doesn't mean that special emphasis and early diagnosis is critical just to preserve, the patient and their skin integrity. So what we're going to do is we're going to go ahead and kind of just do a visual walkthrough of these three different pictures along with the different skin types. Now, if you look up to the top left corner, that is the light skin tone. And this first image taken from the light skin older adult, I just kind of want to draw attention to the lesions across the central facial area. The lesion appears kind of as this red raised plaque with this pearly translucent quality. And then if you look specifically on the outside borders, you can see those, what looks to be like those rolled edges. And on the surface there are fine, like those telangiectatic vessels you can see pretty predominantly throughout this whole image there. These visible blood vessels are more apparent in obviously the lighter skin, and that is really due to reduced melanin production. So this appearance reflects abnormal basal cell proliferation with that local invasion. Excuse me. And that is what causes that elevation and that vascular prominence that you're going to see in those light skinned people. Now, over here to the left at the bottom, that's what is classified as the middle skin tone. We'll say image 2. So in image 2, it represents a medium skin tone person. The lesion is localized along the lateral facial border. If you look, you can see that. Here, the borders are still elevated, like as in the first one, but less striking compared to the first image. If you can compare them, you can see that it's not quite as noticeable in the first image. The color is to more tan to light brown rather than that pearly color that you see in the light skinned folks, which can make this lesion easier to misinterpret as like a benign pigmented lesion opposed to the BCC, right? And the surface appears smooth with that focal crusting. And, in this specific skin tone, the redness appears to be like a little less obvious, right? So clinicians can relay more heavily on the border's irregularity and the texture rather than the color alone, simply based on the fact that the patient is a middle skinned colored person. And now, if you look to the right here, this is what we would consider image number 3, a dark skin tone. The lesion here appears as what looks to be a very firm nodule along the cheek area, very obvious where it is. The borders are less distinctive and kind of blend in to the surrounding skin, which increases the risk for that delayed diagnosis, right? The color is a very deep brown to a like violaceous rather than the pink colors that we've seen in the two previous images, which is kind of one big noticeable difference among the different skin tones. And there is like a subtle surface alteration and increased pigmentation masks the classic pearly appearance, making this lesion more likely to be mistaken for a scar or like a benign growth. And here is very important information is a common diagnostic pitfall with these dark skinned folks is assuming that skin cancer is unlikely in the darker skin tones, which may have in the past and may potentially still delay the biopsy and the treatments because providers are just kind of assuming that it doesn't happen. So the assessments are not getting done as they should. After just looking at these three different skin types and the presentations of the cancer themselves, all being within that one specific family, but I mean, you can very visibly look at these and say that these are not of normal origin. Something's definitely wrong, but the way that they present is different based on the skin tone. So, one way that I will change my skin assessment is to practice by placing less emphasis on like the redness and more focus on the lesions and the borders, the texture, and the surface changes, as like you can see in these images right here, especially in the older adults with colored skin. I'm also going to maintain a lower threshold for biopsy or dermatology referral when the lesion shows if it's like asymmetrical, it's elevated, it kind of, a patient comes in is like, I've had this here for a while. It's like that non-healing features, regardless of the pigmentation. I think just given how common it is in older adults, a specific skin cancer, being willing to just say, this doesn't look right. We're going to go ahead and refer you out to dermatology.